Hello, my name is Eleni Kakalou. I'm an infectious disease clinician working for the National Health System and for the School of Medicine of the University of Athens. As you can see from my CV, I've worked with MSF in the field. I'm a member of the board of directors. I'm representing the Greek section to the International General Assembly. I've served at the board of directors of the Operational Center of MSF in Barcelona. I've been working for 10 years at the Global Health Master Course and Disaster Medicine postgraduate program for the University of Athens. And after my work in the field with MSF, the Master Course program has offered me the opportunity not just to build skills, but also to work even for short periods of times in hospital in Tanzania and Ethiopia and keep touch with the global health agenda. Through my recent work at the referral hospital for COVID-19, I have come to appreciate even more what I already knew, that there is a serious gap in understanding why a multidisciplinary approach, developing skills outside your direct technical field is necessary, and why people with enough operational experience abroad with international organizations, with NGOs, having worked with other Ministry of Health in different countries are really important in the pandemic response and future challenges in my country. So I hope that if I'm accepted in this training, I would be able to put it in good use through both my work in the University of Athens, but also the National Health System and my work in MSF, and the network I have with other NGOs and other stakeholders in the country. Concerning the two questions, I think that it is really, I would like to take question number 2 and question number 4. So as schools are concerned, it is really important to involve parents and teachers from the beginning in creating the response and putting down the protocols and creating the messages. I think that a random sampling of asking people to participate, both from teachers and parents, would be really nice, because it would create more trust and it would cut the layers of representation from citizens. I think they should be from the beginning part of the design of the response. It should be explained that there are risks involved, there are unknown factors, but what we have to do is to invest a lot in creating clear messages, into understanding the risks we're taking and the measures to mitigate them. And also it would be really important to put in place measures for people to have direct access to information, to testing, to clinical care if needed, and also protection from their work or anything else they need in case they have to make it possible if they have to keep their children at home should they be sick, and the same applies for teachers. So transparency, trust, clear messaging, and involvement from the beginning is really crucial. Now, concerning question number 4, I think that exactly the same principles apply here. What has been really disastrous has been a back and forth in the way we convey public messaging, eroding the trust of the public. So if we would like to create public messaging for different groups, we should make them part of the design process from the beginning. We should go for a random sampling of these people, not just going through associations, organizations, whatever, in order to reduce the mediation process and have this feeling of an everyday person being part of this. We should use behavioral scientists, anthropologists, and then we should go back to those teams, have a robust methodology for testing these messages, get the feedback, and make sure that with a lot of transparency, trust, we convey them back. Thank you very much.